Morning everyone. Myself Dr. Sachin Patil, SAI Piles Clinic Pvt Ltd, RPD Cross Tilakwadi, Belgavi. On the eve of World Fistula Day, which was in the last month, 23rd May, has been celebrated in order to make aware among the common people regarding the fistula. So, everybody's common language or the layman language, we can say that anything happens to anything happens to him in relation to the anorectal disorders, he call it as a piles. Piles is uncommon man's or layman's language, but it is not true. Piles is different, fistula is different, fissure is different. Among these anorectal conditions, fistula is said to be one of the difficult tasks for any clinician or a surgeon to manage and to eradicate this completely, because there are 2-3 things which can make difficult for the management of the fistula. One is its reoccurrence, second is it's damaging to the sphincter. While doing the operations, one should have to take utmost care not to damage the sphincter complex, and the third is its chronicity can leads to C of rectum in a very small percentage, but it may turn into a cancer. So in this regard, I would like to make you aware regarding the fistula, that if you are suffering with any of the conditions pertaining to fistula, there are various types of the fistulas, and among those, the complex fistulas are difficult for the management. Again, difficult fistula itself is a difficult, complex fistulas are more difficult for the management. When we come across the high level fistulas like supralevator fistulae, horseshoe fistulae, or rectovaginal fistulae, scrotoanal fistula, and fistula with ramifications, branching fistulas, all these are very difficult for the management. Then question arises, whom you have to approach for such a fistula management. So general surgeon is also going to treat the fistula, colorectal surgeon is also going to treat the fistula. Some of the roadside practitioners, what do you say, that the quacks are also going to practice, like Chansi people, Bengali people, etc. Apart from that, Ayurvedic surgeon is also going to treat the fistula. To whom to approach is the question mark. So in such conditions, you have to approach such a surgeon who is not only qualified but also having a very good experience, and also he is skilled in many of the treatment modalities, like minimal invasive techniques is the today's trend. Previously, fistulectomy, Gabriel's two-stage operation, these were the treatment modalities, but now the trend has been entirely changed. Now people wants that minimal damage to the surrounding tissue. In this direction, minimal invasive techniques have been evolved, and many of the minimal invasive techniques are the radio frequency, laser ablation, tropies, DLPL, lift, modified lift, PCM. These are all the techniques which are available for the management of the fistula in ano. The wise surgeon is one who is going to choose appropriate treatment modality, minimal treatment modality, and clubbing it together, making it as a hybrid technique and using it to the management of the fistula. What do you mean? So the minimal invasive techniques are not only going to eradicate the fistula completely, but take care of its reoccurrence, but take care of its sphincter sparing techniques. These are sphincter sparing techniques. These techniques are not going to damage the sphincters at all. So post-operative complications like fecal incontinence, etc. will not happen by these treatment modalities. So a wise surgeon is going to choose these treatment modalities and club together to eradicate the fistula completely. So my kind advice to you people is, before you approach a surgeon, you should have to evaluate the surgeon's qualification, whether he is qualified surgeon or not. Second, whether he is skilled in the minimal invasive techniques or not, whether he can use the hybrid techniques or not, whether how much assurance he is giving to you that 50%, 60%, 90%, 95%, what is his confidence level of treating such a fistulas. So you have to evaluate everything, treatment modalities available is in his clinic or hospital, and the knowledge of surgeon. These are all the things plays important role in judging uh, the one who is treating the fistulas. So evaluate all these things and then approach a surgeon for your best treatment. Many of the colorectal surgeons opined that treating a complex fistula is more difficult compared to the treating the rectal cancer. This is going to explain about the difficulty in the management of the fistula. This is opined by many of the colorectal surgeons. One more quote I would like to give you, that don't underestimate any fistula, however it may be very small. And the third quote I am giving you, that if you want to defame any reputed doctor's name, just refer single case of fistula. All these quotes are going to indicate that how difficulty we get in treating the fistula because of its huge reoccurrence, because of its sphincter damage chances, and its conversion into a CA, a very low percentage, 2% you can say, among 100 2 patients may get converted into the CA of rectum. But these are the codes which have been mentioned to understand the seriousness of the fistula.